Hi, this is State Delegate Janelle Wilkins from District 20 in Montgomery County, and you're listening to the Conduit Street Podcast, the best source of news and notes on Maryland politics and policy. The Conduit Street Podcast, the official podcast of the Maryland Association of Counties.
Welcome to the Conduit Street Podcast. I'm your host for today, Michael Sanderson, director at the Maryland Association of Counties. And we want to spend some time today talking about a topic that really affects every Maryland community, whether you're raising a family, running public services and schools, serving in local government, or just trying to live a healthier life. Public health and watching your health isn't just about hospitals and on the treatment side. It's about the policies and the environments that can help people stay healthy in the first place. And that's part of our public mission as Maryland counties. Karrington?
Yeah, thanks for having me on the podcast. And we are excited to welcome Laura Hale from the American Heart Association. Laura works on state government relations here in Maryland, where she's involved in everything from improving children's nutrition to tobacco prevention and cardiovascular health. Laura, thanks so much for joining us.
Thanks so much for having me on. Excited to have this conversation today.
Very good. And Laura, before we dive in, tell our listeners a little bit about the American Heart Association. Most people know the organization because of heart disease research and awareness, but I know your work reaches far beyond just hospitals and doctor's office. What does your advocacy work in Maryland look like?
Appreciate it. The Heart Association does a lot of work across a lot of different sectors, certainly known for our work with hospitals, but in the advocacy space, we're really looking at how can we continue to make systems to help people stay healthy. Things like some things we'll talk about today, healthy school meals, addressing tobacco use, looking at access to health insurance, access to healthier foods, and really looking at what we like to call life's essential 8. Those are the different factors and behaviors that help us stay healthier. Things like being active, getting healthy sleep, quitting or never starting tobacco use, eating healthy, as well as controlling our cholesterol, managing weight, blood pressure, and blood sugar.
So Laura, thanks very much for joining us. On the podcast over the years that we've been doing it, we sort of started out thinking our core audience were going to be county officials and, the elected people and the managers in county government. And we do have a nice substantial following of county leaders, but also other people who are just generally interested in policy and politics, mostly at the state and local level. So we're Maryland focused, although most of these issues are pretty global. But let's start in one of the areas that does kind of get into where our little Venn diagram overlaps to some degree. In county government, thinking about public service, you already mentioned school lunches and school meals and so forth. Our local jurisdictions have gotten increasingly invested on that front. School lunches have been a thing forever. The notion of getting some students access to nutrition early in the day through Head Start programs and related offerings has expanded and been successful across the country. Since the pandemic, we've seen a big uptick in schools wanting to offer nutrition programs into the summertime when regular classes aren't continuing. And I think that has been an upward trend anyway. So we're invested in child nutrition, and the schools as county government's partners are big players in there. So I'd be interested in having you elaborate a little bit on AHA's role on that front and how you've been making gains in school nutrition.
Oh, certainly. So school nutrition is one of the spaces that we really care about. The school meals are actually one of the healthiest meals that kids on average eat in a day. They're very, very well balanced. When you go to a school lunch, even if you see a chicken nugget, that's not just a regular one. It has a really high nutrition standards that the AHA helped work on those standards at the federal level and has been implemented here at the state and local level. And really, they are a good way to balance and continue to to pull in different kind of food and nutrition for our kids to continue to learn about all the great foods that we can eat here in the state. And one of the good things I love about our school nutrition directors as well is that they're always really looking to see how they can pull in Maryland local foods as well. Y'all may have seen a little bit down in, I think it was Caroline County, looking at using some of the blue catfish as part of school meals and other things here. Yeah. Down this way to really have that tie. And we've been working for a number of years now at the state level to try and get funding for school meals so that every kid can have no-cost breakfast and lunch when they go to school. Right now, it's a mix. Some of the counties and individual schools qualify for some federal money to help. Some do not and need that additional match. Some counties, such as Baltimore County and other counties, have stepped up to help to pay for some of those schools that need those additional dollars. And so we'd love to keep those efforts up, and have been working with Delegate Polakovich-Carr and Chairman Gazzoni to really look at how we can pay for all school meals across the board.
That's great. And yeah, I love the example of the catfish there. And I know, so counties, yeah, we fund local schools, but also operate local health departments. Definitely a priority from their side of things as well. And I guess sometimes people think of school meals simply as just making sure kids aren't hungry, like feeding them breakfast, feeding them lunch. But I know we've kind of talked about the nutritious school meals, and would love to hear maybe how nutritious school meals influence things like long-term health, learning outcomes, or even the chronic disease prevention.
Certainly. When kids get that healthier start, then it sets them up for long-term health. School meals really introduce whole grains, making sure that kids are getting good sources of calcium with milk, as well as introduction to healthy fruits and vegetables across the board. And when they see that on the plate and see portion control, it really is helping them to get a good start and to try new things. My daughter is in kindergarten, just finished. She's going into first grade, and she talked about she came home one day and informed me that we needed to make kale chips because she had that as part of her school meals and that it was very good, and she wanted to know how to make kale chips. And it's one of those things that I might not have made, but it is something that we're seeing for all kids across the state, is that our school nutrition directors are really doing a good job of making food fun and accessible and something that gets us started. And we also know that kids that eat learn better. We've got a lot of big things the states are working on right now with a blueprint to make sure that our kids are doing successful in the long term. But if they're hungry, they can't learn. And so having those nutritious breakfast and lunch makes such a big difference in making sure our kids do well.
I think there's an angle there that's not completely obvious, but as you say it, I'm here nodding my head. You think of, okay, we launch a program to make sure that there are healthy options and like appropriately sized portions as part of a school lunch, that sort of thing. And in my mind, what you've accomplished there is at that meal, that student will have, something that's right on target, the right quantity and the right kinds of offerings and so forth. But as you mentioned, it strikes me, you also can help set expectations about what are the right kind of portions to be eating at your midday meal and what kind of things are the best side dishes. And when you're eating carrot sticks or kale chips, instead of, tater tots or whatnot, to some degree, you can expose kids and inform them that this is food that's going to make you feel better, and you're going to be fine with that. If you're not getting access to that at home, a kid who comes home and demands it from mom is like, that's a really great outcome that hadn't been obvious to me, to be honest.
Certainly. And our school nutrition directors are always trying to find, the new foods to keep exploring those with kids, and really makes a great balance at the end of the day for our kids to learn and explore and do taste testing as well with them.
So are there more steps that we can take on this front? I'm thinking about like offerings at our county governments who have a cafeteria or a canteen or something like that for our public employees. cities. That's become increasingly popular, especially for some of the larger jurisdictions that have a county government building or complex. That's an increasingly common setup to have a central place where folks can go, grab lunch and that sort of thing. What other opportunities are still ahead for local governments and schools to partner with and sort of take the lead from groups like AHA?
Yeah, we're happy to help with setting out nutritious ideas and where to balance. And even in the policy space, we've been working on a variety of nutrition-based options at restaurants. One of the things I worked with Charles County, and my counterparts were working with Montgomery and Prince George's, as well as Baltimore City, is making sure that there are healthy options for kids at the restaurant level. So making sure there's at least one healthy drinks on the menu and at least one healthy meal option too for us. And so happy to help and support the counties in introducing more healthy foods into their offerings.
Yeah, I really appreciate that. Okay, so switching gears and really just something I can't help but ask here. This has officially become my favorite headline. I saw that the American Heart Association released a statement suggesting that for most healthy adults, drinking up to 5 cups of caffeinated coffee a day could actually fit within a heart-healthy lifestyle.
Oh, yes. Our research folks have been looking at those levels for us, and they could speak more to that than me. It's really something that's important to look at it and to watch your caffeine level, because that second line is looking at concerns around energy drinks and how those can be a little bit high for us on these things.
Well, it finally feels like some good news.
Certainly. One of the things as we're talking about drinks that really surprised me is that kids on average drink a bathtub worth of sugary drinks a year.
What?
Yes, a bathtub's worth. I love our research folks. They can really dig in for us. They told me that. And it's part of why we've been looking at how can we make it easier to know what you're consuming, because that's a lot of sugar that you don't necessarily know that you're getting in a lot of different drinks.
But that's exactly, I think, like a good way to put those things. Like if you say an entire bathtub full of sugar, like that's not an image or something you're going to forget. Like I like how you guys frame those things. It sticks in the brain.
Yeah, so much more effective than saying, 158 grams of refined sugar over the course of a typical week. That feels really abstract to me, and I think most readers or listeners, but the idea of over the year, a bathtub of sugary drinks, like I can visualize my poor kid in a bathtub of Coca-Cola, right?
Right.
Oh, certainly. And that's part of why we've been working on, so much of when we go out to eat. I'm a busy mom. I mean, I know y'all too. When we're up in Annapolis, our hours are crazy. So we go out to Maryland's great restaurants, probably more than we ought to, on all good things, because that's just reality. And so making sure that our families and ourselves are eating healthy things can be difficult. And so part of what we've been working on is some legislation called informed dining. And what this legislation would do is that it would add an icon on the menu if something was high in salt or sodium or high in added sugar. So as you're looking at the menu, you could take a look and say, oh, this is something that's high. And it would flag things just to make those decisions easier for you as a family. One of the things that was surprised me as I was digging through it is that sometimes some of the salads at different restaurants have as much salt as some of their high sugar types and would have that warning on it. And some of the thing that always gets me is the smoothie bowls. Some smoothie bowls are fine, but some of them have as much sugar as a milkshake. And frankly, I'd rather have a milkshake if that's the decision I'm making.
Right.
And having that easy access is something that we're looking to do. And it's something that counties can look at that legislation as well as we're working at the state level on this.
So the central idea there is to try and expand information, like you're calling it informed dining. This isn't telling like a private restaurant, get that stuff off the menu. That's, this isn't like the heavy-handed tactic, but rather consumers are in a tough spot reading through the menu at a restaurant, and like especially sodium. In my experience, my family is, I think, relatively tuned into nutritional issues and so forth, probably more than most, but the presence of sodium in prepared foods can be alarming when you look into it. And some of those issues would not be obvious. You wouldn't think of like that, the complicated salad offering at a restaurant. You may think of that as a healthy option, but if it's high in sodium, having a note to that effect, and if you're sensitive on that front or have a family member who is, that feels like a lot of benefit to our residents as consumers there in ways where we can give them a hand up and let them make better informed choices. Right?
Oh, exactly.
Right.
And it's made a big difference. New York City has had the sodium labeling at chain restaurants for close to a decade now, and Philadelphia does too. New York City just implemented the added sugar labeling. And we've seen from the data out of New York is that, especially in certain communities, we're seeing decreases in high blood pressure rates, which is one of those markers with high salt consumption. Also, New York State just passed this kind of legislation on the sodium side. We're just waiting on the governor's signature. So we'll see that soon as the first state with it.
And yeah, I was kind of curious what other states were doing there. So that's interesting to see that New York is doing that as well. And yeah, I really like this approach because I think for something to be successful, it has to be as least complicated as possible. And kind of this approach is giving people more information without overcomplicating it. So I like that a lot. And I know another issue that you all have been working on involves tobacco prevention and youth access. We've heard quite a bit recently about Baltimore City's efforts surrounding smoke shops. So for listeners who may not have really followed that issue, can you give us the short version of what those efforts are trying to accomplish?
Certainly. And we were excited to get to partner with Baltimore City with their efforts to address smoke shops. And so local counties have the authority through their zoning powers to be able to say where smoke shops and tobacco retailers are located. And there are some unfortunate limits due to some preemption. I'm sure Michael can explain better than me on that. But they are able to limit some of those locations. And we're thinking about like not having smoke shops near schools, not having smoke shops near healthcare facilities and other places as well where kids are going to be, where they're seeing these products all the time. Also, there was an issue in Baltimore City in density. We, at the state level, we have licensing for tobacco, and Baltimore City had more licensed tobacco establishments than anywhere else in the whole state, followed close second by Prince George's and then Baltimore County. And that density makes a difference when we think about kids seeing and being around and the normalization of tobacco. And so Baltimore City has stepped up and is using the authority they have with zoning to be able to limit where these establishments can be licensed, which will make a big difference at the end of the day when we're doing that. And it really speaks to the counties are great partners with the state. The state has stepped up and done a ton of great work in tobacco over the last several years, and counties are stepping up too with where they can be involved.
And Laura, you gave me an easy entree to get in one of my favorite little rants about local authority.
Oh boy.
This issue of regulating tobacco and tobacco products and cigarettes and so forth is one that has a kind of a long tail here in Maryland. I'll try and abbreviate what could be a 45-minute go for the subscriber only podcast feed sort of thing, but just compress this. Decades ago, we had a number of jurisdictions who had tried to respond to local problems, particularly access by children, but some other issues too, through some local tobacco laws. all of which were basically wiped off the books, not in Annapolis in a public hearing in a setting where all the stakeholders could be held and the legislature changed the law, but actually just in the Maryland courts. The courts relied on a peculiar doctrine of implied preemption. They basically looked at the body of state law that governed tobacco products and concluded the state seems to have fully occupied this field. And as a result, there's not really enough room for Talbot County or Prince George's County or Baltimore City to have these local laws on the books that make them different than their neighbors. And so we hereby just wipe all that stuff out. That's been super frustrating for an organization like MACO that advocates for communities to be able to respond to their local concerns and local problems. I know we at MACO, we've worked together with the American Heart Association and some other allies over the years to try and strengthen local communities' ability to address health threats and issues like that. Any updates or other things that you could share with our listeners on those kind of topics, either in recent years or going forward?
Well, I'm very excited to say that this past legislative session, we were able to restore a little bit of Baltimore City's local authority around tobacco with the passage of legislation championed by Senator Hayes, which will allow Baltimore City to set up kind of a pre-licensing authority. So in addition to the zoning authority they already have, they're going to be able to say yes or no to licenses coming into the city and are working on setting up that infrastructure now. So the state has given them a little more authority, and it gives me hope for the future that we can continue to build as the state can see once again what a great partner our counties can be when it comes to tobacco.
Yeah, we appreciate the efforts there.
Yeah, it's baby steps sometimes.
It is.
And I know another important piece is preventing the youth access. What are some of the policies that you all are supporting when it comes to reducing tobacco and nicotine use among young people?
Certainly. I think we're really looking to continue to grow and expand. The state has done a really good job of setting up a licensing system, which is one way, and doing compliance checks as tied to that. So we can check and see, hey, making sure everyone who's selling knows the rules and that they are following them. And the state has also raised the tobacco tax, which is another effective model at helping to limit youth access. If it's more expensive, they're less likely to buy, as well as continuing to keep a strong, clean indoor air bill. We want to make sure that there's not a normalization of smoking again. And so making sure that we keep the strong legislation that the state has passed, including making sure that cigar bars, so that normalization of drinking and tobacco use does not become a thing. And so I'm very happy for the championship there. And there's more that can be for the future, but excited that the state has continued to really make strong steps and fund tobacco control program. The department does a great job at stepping out and helping to educate the public and supporting the quit line so that smokers and tobacco users can call and text now to be able to get support in quitting smoking. And that's because of those dollars the state's investing right now and the great work of the department.
So I mentioned earlier that we've got sort of a wide band of folks who have found this podcast useful or interesting for a wide range of issues. But for the moment, I want to give you an opportunity to just sort of speak directly to leaders in local government. So someone who today is a county commissioner, or they're in the process of running for their county council and they anticipate becoming a county leader soon, and they've decided this is a place to start boning up on topics. Like speak directly to local government leaders or community leaders. What's the sort of thing that you would encourage them to keep in mind as they think about, guiding and leading their own community back home?
For me, health is so local, and local governments are a key part of how we set up a healthier Maryland. So please give me a call. We can work on things like informed dining. We can work on limitedly tobacco control, and we can come at other bases to think about nutrition and what's going on in the community. And even outside of the advocacy space, the Heart Association right now is working across the state doing things like supporting community gardens, looking at making sure that there is access to refrigeration at our food banks so that people have access to those healthy fruits and vegetables, as well as other opportunities to get involved with the Heart Association. So would love to work with all of you and be really a thought partner in ways to look at nutrition and other things across the state.
I really appreciate that, and definitely think there's a lot of ways that we could partner there, both county governments, also our local health departments. I think we have a lot of shared priorities there. And before we let you go, Laura, is there anything that we didn't ask you that you'd like our listeners to know about either the American Heart Association or your work here in Maryland?
Well, I think I'd be remiss if I didn't let you all know that we have our Heart Walk coming up on October the 10th over in the Camden Yard Sports Complex. So we'd love to have you all there. And also, in addition to all of our work in the community, we also do invest in heart research. And in Maryland alone, we invest $17 million right now in current grants looking at heart issues here at home. So would love to partner with you all in these spaces.
Perfect. Well, we'll make sure those grants that probably can add those in our show notes to show people there.
Wonderful.
Okay. Well, I want to thank Chantel Malcolm Lim, our producer, and just kind of a quick reminder, our 2026 summer conference is coming up August 12th through the 15th, a theme of Build What's Next, and that's at the Roland Powell Convention Center in Ocean City, Maryland. There'll be some really good content, and we hope to see you there. All right, well, that is it for us. If you enjoy hearing about local politics and policy, be sure to subscribe to the Conduit Street Podcast from whatever device and service platform you choose. On behalf of our host, Michael Sanderson, and our guest, Laura Hale, this is Karrington Anderson. Goodbye, and we will talk to you soon.